My name is Srinivas Jolepalem. I'm a physician working with IMMPACT, taking care of the patients in the different nursing homes and assisted living. And they have been doing this for so many years. So they have been improving the quality of care for the patients, preventing hospitalizations, and then doing the wellness visits. And with all the HIPAA and all the confidentiality, so we can't use our own cell phones. So in that way, the Hucu was very helpful, because it's easier to communicate with the nurses and the caregivers for the patient, and sometimes with the family members. And then the information is all protected, and it's easy to use and easy to get trained. So even the X-ray reports, lab reports, they can all be uploaded in the Hucu and then immediately available. Sometimes with the other systems, it takes some time to go to the fax machine, look at the reports, and then again there is some delay in finding the abnormal findings and patient reports and then responding. So with the Hucu system, it's more user friendly and more faster. It's almost like texting with the family members, and there is speed involved and the comfort. So it's not too complicated, easy to learn, and there is good support. Sometimes in the clinic and the hospital work I was doing, there was so much piling of paperwork, and then there is a chance there is some abnormal labs could be missed. So here things are much more organized and more efficient compared to the other telehealth systems. Some of them are a little complicated. We have to go into a website and then go to and then second site, and then sometimes it's hard for the patients and the caregivers to go into the system, whereas in Hucu it's just an app, so they can easily get into the system. And then for the nursing homes and then the assisted livings, usually the nurses train each other, and then maybe the Hucu staff can train them, and then it's easy to learn. So easy, it's comfortable for the nurses, so they are using it more often compared to with the other telehealth systems. So with the COVID-19, with all the restrictions in the different facilities, so one of the thing is some of the facilities I need to get a COVID test done. It has to be negative before I go and see the patients. And then also they have some restriction. They don't let a lot of people come in at one time, so we have to space it out. Some of the facilities are worried some of the providers can bring the infection to the patients, and or we can get infection from the patients, especially in some of the closed facilities. The patients are spreading infection from each other and maybe from the nurses. So it's not a good idea to do too frequent visits. It's risk for the providers, risk for the patients, risk for the health staff if it's not needed. And then with the Hucu, we can do face-to-face visits through telehealth. And then the patients are happy, their problems are taken care of, the liability is less, that we are not seeing the patient, and then we are not doing unnecessary face-to-face visits and contributing to the spread of COVID-19. So it's win-win situation. Without the Hucu, it's just the phone communication with the patient's nurse, and then also the faxes and the mail I receive from the nurses. But with the Hucu, I can see the patient, if necessary, every day or every other day or as needed, and then I can see the change in the patient, with whatever treatment I am giving. If the patient is clinically better, looking better, feeling better, and then the patient tells the subjective feelings through the Hucu, and then I can directly address the concerns of the patient. And then so it's a technical support, but which is pretty simple, easy to use, and then it's helping for the care of the patient, especially in the COVID environment where it's like more difficult to do face-to-face visits. So, and maybe it's like helping to save the patients, and then also like some of the patients who need not have to go to the hospital. It avoids the hospitalization. Sometimes unnecessary hospitalization is not good for the patient. Waiting in the emergency room, sometimes they catch infection from other patients, and then some of the elderly patients get delirious in the hospital environment. So we can directly address a lot of the medical concerns through the telehealth visit. So compared to the other telehealth services I use, like with Practice Fusion or One Touch, so Hucu is much more easier to use and very user friendly, and then like it makes the work flow easier, and it's easier for the patients too, like compared to the other telehealth services. So it makes my job easier. So it was like comprehensive and complete like orientation on the different sections of the Hucu app, and how to sign in, and then what are the different technical services available, like texting and Zoom, video conference, and direct communication with other providers, and other like general information where we can share with the other team members. And after that I get follow-up like emails and also analytics, like how we are using the system, like how often we are using the texting and other systems. So like we get updates frequently, and then that's helpful. So we get feedback from the other providers, and then we communicate with each other and try to see how we can, as a team, with the help of the Hucu, provide better patient care. The most useful to me is the channels and the patients, because like that's where I try to go first, and then where I get communication from the nurses and the nurse practitioners. The Hucu was able to add a new channel in the configuration. It's called sign off channel. So in the sign out channel, like after the weekend rounds, all the information about the patients we took care of who need follow up by the primary doctor in the facility, we can put in this new sign off channel, and this is very helpful, like for the primary provider. Once they come on board on Monday, they can focus on the abnormal or what happened in the weekend. If the patient is really sick, they can go and take care of those patients first. Before that, like we had other ways of communicating. We were like leaving the message by voicemail, but sometimes it's hard to listen to the voicemail. But sign off, we can just text there all the information, so you can look at it in their free time, like whenever they want, like they don't have to listen to somebody talking. So this is more useful or convenient, like more easy to use, the sign off, and it's very helpful for patient care. So whenever the patient is discharged from the facility, so like the discharge summary can be like uploaded in the Hucu, or like faxed through the Hucu. And then also when the new patient comes, like the history physical also can be uploaded in the Hucu, and the medications of the patient, and then if there any records are there, that can be also like uploaded in the Hucu. So we can get all the information and then save it, so that like once the patient comes, we have the comprehensive information. When there is follow-up, we don't have to like go on searching for the information. So the Hucu helps like to have all the information in one place for the patient. Before, like with the other telehealth system, like I was spending a lot of time like trying to communicate with the patient, and then documenting my notes, and also like all the changes in the patient from day to day. But with the Hucu, like might have saved like so many hours of my time and the nurses' time, and the patients are more happy. Like it's easy to use, and then their problems are taken care right away. Sure, yeah, I had a patient, the nurses were saying like she has shingles on the face. So I wanted to make sure whether it's shingles or any other infection. So we had the telehealth visit through the Zoom through the Hucu. The shingles infection of the face is very serious because it can spread to the brain, and then that can cause like complications in the brain. Patients can get confused. They have to be sent to the hospital right away. It was like a circular raised lesion, like a ringworm infection. Didn't look like a shingles infection. So like with the Hucu telehealth visit, I was able to diagnose ringworm infection, and that avoided sending the patient to the emergency room. To the unnecessary hospitalization was avoided, and then spread of the like coronavirus infection like patient can get from the hospital or emergency. All these are avoided, and the patient was happy, and we were able to take care of the medical problems with the help of the Hucu. And I had another case. The patient fell down, and then the wound was not healing, and the patient developed like osteomyelitis. And I can, through the telehealth visit, I can see the bone through the video conference. So that's consistent with the osteomyelitis. Patient had fever, and so I sent the patient to the hospital right away, and then patient received IV antibiotics, and then they were able to control the infection before it spread to other parts of the body. Sometimes like with osteomyelitis, if it's serious, then they have to get IV antibiotics for longer time, and some people get like amputation or other surgeries. We could avoid all that with the timely telehealth intervention with the help of the Hucu. Yeah, we feel like we are doing our job, and feel happy that we were able to diagnose and then treat the patient. That's like part of our job, because with all the hindrances with the coronavirus, not able to see the patient face to face and all the restrictions, so this was like a great blessing. We are thankful that Hucu is there to help the patients and the providers to continue to provide the best care for the patients in a timely manner and avoid complications. And then like some, as we know, like some of the patients are dying because of delayed care, and then the Hucu is helping us to provide the proper care immediately as soon as possible, because it's easy to use and user friendly for the patients, the nurses, and the physicians. So my dream for my practice is to provide the best patient care. If we get all the pertinent like medications and the lab results through the Hucu, so I have all more information available right away, and also the face-to-face visits like through the telehealth. So I can directly communicate with the patients, see how they are looking, like that gives a lot of information. And then also like focus on the pertinent problems in a timely manner. So in the different settings. So I think we are going in the right direction, and then as time passes, we can go on improving the quality of the different services in the different settings and provide the best patient care and avoid liability, and also get the satisfaction of providing the best care for our patients.